Welcome, Lloyd. Nice to see you again.
Thank you.
We're going to do a little bit of an episode on the Man Health Clinic, which is a clinic that you run for men's mental health and general health.
Yeah.
Do you want to tell us a little bit about that and why you started it?
Yeah, so Man Health Clinic is a clinic that I run in Hollywood Medical Centre in Netherlands. It's been up and running about 9 months now, and it is my brainchild, I guess, with a few different reasons for setting it up. One is my absolute passion for men's health, both physical and mental. It is from the realization that men require a pretty unique approach to their health. Different to women. Men need convenient, friendly, different types of environment to start engaging with their health. And I think for me, my interest in my own health and thinking, well, let me go on a journey for my own health and also create this clinic to hold a bit of accountability maybe. You know, I can't be the face of a clinic that's emphasizing good physical and mental health when mine isn't maybe where it should be. So
I'm imagining this a clinic. There's a pool table. There's a pub in there. There's a barber shop. Is that
motorbike in your waiting room?
Yeah, motorbike. Is that what it is?
You know what? You're not far off where I want to be. I want this men's health hub. I'll be completely honest with you. Yeah, it's not there yet. It's a friendly environment. It's quiet. It's in a specialist clinic room. Yeah. There's no women, children, no big posters on the wall about getting your breast screening and your cervical screening and getting your kids immunized. It's, there's a place for that, clearly. That's what I do a lot of my week as a GP. I do a lot of, I'm a GP at the end of the day as well. But this clinic is that one day, but I try and make it male friendly, spending the time with guys, parking's easy. The times that I run the clinic, Wednesday evenings, Saturday mornings, Friday mornings. I'm trying to keep it mixed up. So, we joke, but absolutely, I'd love the ice baths, the saunas.
Yeah. Well, one of the reasons we started 20 Talk is because I guess we saw all this great evidence and support and clinical evidence, but it just wasn't connecting to young people in a way that they could relate to. So there was no point of it really existing. And I think in some ways you're probably along a similar vein here. We've got this support and education for men's health, but men aren't engaging with it.
Absolutely.
So we need to think of a new strategy.
Yeah, all the policies are out there to say, all the evidence is out there to say that men need this different approach to their health. And yet I was still day to day seeing guys come in for 8 minutes, and not addressing their health needs because the clinic that I was sat in just wasn't able to cater for that. Like talk about the waiting rooms, the times, how we're always running half hour, an hour late. That frustrates guys. We're busy. We've got other things going on. So it's the realization that, we need that different approach. And I couldn't see it anywhere. So I thought, I'm going to do it myself. So hence, here I am.
So the only GP in Australia that runs on time.
Yes, you're not wrong.
How long are your sessions? Like how long...
So my model is such that I run an initial face-to-face appointment that's anywhere from an hour to an hour and a half. So I really get guys in and I sit down and say, let's go through your whole health, systems review, mental health, physical health, sexual health, prostate health, family history, social history. Are you smoking? Do you want to quit? All these things that we know we should be doing as GPs. We've got 8 minutes to do it. So here I am saying, no, let's go. I want 90 minutes with you and give me that time. And I truly believe I can really help. Then I will investigate blood tests, scans, keeping blood pressure diaries, doing all these other things that I would then like these guys to do and whatever's appropriate. Then you have a follow-up with me about 2 to 3 weeks later via video consult.
Yep.
So I've a lot of my guys, I'm seeing them face to face in Hollywood 1 week. 3 weeks later, I'm seeing them up in Port Hedland while they're sat in their rooms, FIFO workers, and they love that because it's approachable, accessible. And then I do another follow up, probably 2 to 3 weeks later, where we're discussing more results, starting to create a priority list, start treatments. I'm prescribing, I'm running a normal medical service, but that's just accessible and approachable. And then what I do right at the very end is I provide a written health summary, what I call a continuing health plan, so that guys can really start to think, okay, here's my list of problems, goals, here's my recommendations, and then what I really want to do is see them in about 9 months and say, let's do it again. Where are you at? Which way are you going?
And so what's the kind of main reason men come and see you? What's the main problems that they kind of, address and say, hey, I need to get checked out?
Great question. So I see variation. That's the nature of my job, I guess. A lot of my guys are between 40, 50, 60 who've got to a stage where they've realized I've neglected a lot of my health to this point. And I've got mates around me who are starting to experience these mental health issues, physical health issues, prostates, heart attacks, strokes, and various other problems, and go in, actually, I really need to do something about this now. So I'm seeing a lot of guys at 40 and 50, which is great. And I love seeing them because they've started to get a few problems that they're neglecting. They don't even know they've got. Screening that they didn't even realize they should be having.
Yeah, that's good.
Prostate checks that they should have had 5-10 years ago that they haven't. So that's really satisfying. I'm also seeing guys who are pretty proactive with their health, sort of early 20s, saying, look, I haven't got a problem, but I've got a list of questions. What's my prostate? When does it need checking? My granddad's got type 2 diabetes. Do I need to be tested? So there's these really engaging, proactive guys who never get the time with a GP to ask those questions. They don't feel it as if they can. So they come to my clinic and I sit down with an hour and a half, and I'm talking about supplements and, what are you taking? What exercise are you doing? Let's look at your sleep. And so those guys really love that because we can really microanalyze to an extent within reason. And I deal with a lot of guys who are overweight and they want a sort of a doctor-led weight loss program, which I take a bit of pride in and take a bit of a keen interest in. Not everybody should be prescribed medication for weight loss. I love talking about diet and exercise, but there's a certain proportion of guys who maybe need that. And I'm not somebody who's prescribing left, right, and centre. I feel like I'm an evidence-based, reasonable, responsible doctor.
So what about mental health-wise?
Yeah.
Like, how big a part of that is in your practice?
So it's there. This sums up guys. They'll often come because they've either got no problems, they feel, or they're presenting with physical health problems, overweight, obesity, palpitations, and various. Like the list is endless in terms of what their problems may be. But very few of them say, "Look, I'm here because of my mental health." But after 90 minutes or an hour, I've built this great relationship with the guy already. I know everything about this guy. And when I start going through my systems review, and I say, look, mental health, it's so easy to say, how's your mental health? All good? Yeah, all good, thanks, move on. So I say, no, look, we've got time. Let me talk about your mental health. How's your relationship? Where are you living? How are your kids? And before you know it, we start to get these little areas that I say, look, you're not at crisis point. You don't need medication. You don't need to see a psychiatrist. But actually, these are your risks. Look, maybe think about this. And guys start opening up because they've had 60 to 90 minutes with me, as opposed to 8 minutes with a random GP on a street corner. Yeah. That's what. So I can't pretend to sit here and say, look, every patient I'm seeing is coming to me with mental health concerns. But I soon realize and soon start to get that out of guys. And so,
do you think guys? Obviously, a lot of the issues, the symptoms you're dealing with in people's physical health has a root in mental health.
Yeah.
How often?
And vice versa.
Yeah, that's true. How often do you find that people have no idea that there's some sort of mental health issue in the background? Is that quite common?
I think it is. I think whether there's a diagnosis there. We were talking earlier about crisis point and sort of there's a lot of services geared towards people who are sort of at a real crisis and have a pretty clear diagnosis: depression, anxiety, schizophrenia, delusional disorder, whatever it might be. But there's a lot of people in this world who, they don't have a diagnosis. We don't need to label this. We don't need to put a diagnosis and say, look, you're depressed. I'll be honest, I rarely make that diagnosis in my man health clinic. I do as a GP a lot more.
Yeah.
But in my clinic, no, I make that diagnosis less. But what we do recognize is, look, there's a few things just, you're drinking a little bit too much. Have you considered that that's probably related to your mental well-being and dealing with this emotion, dealing with the fact you don't like, you're enjoying work at the moment. So it's just
joining some dots
and start having that conversation. And guys start to say, do you know what? It probably is that.
Yeah,
that's why I'm.
Do you feel like, I don't know if this is a broad statement about Australia, but do you feel like we're too early to prescribe medication rather than health improvement and those kind of, or is that more of a controversial topic?
It's controversial. I trained in the UK, so we have completely different health systems. I'm not going to be controversial in a live platform like this. There are differences in the health system, and I tell you why I think that may be the case is because Australia is more heavily privately run health system as opposed to the UK, which is a publicly run system. So that's all I'm going to say.
I will leave you there. We'll leave that there. But the reason I say that is because I've got a few friends from Europe, and they just tell me that the diagnosis of anxiety and depression over there, they don't give out medication like they do here. In Australia, it's just dished out quite a lot. And we'll just leave that there.
Yeah. No. Well, let me delve into that a little bit because I probably see that. Let me say I see that a bit more. Yeah, I agree to an extent. However, I like to pride myself on being evidence-based. I'm not someone who's just patch this problem up. Here's an antidepressant. There's a stepwise approach here for a reason. Psychotherapy, counselling, mindfulness. Sure. Classic example would be something like insomnia. It's easy to say, take this tablet, it's going to knock you out for the next 7 days. Unfortunately, there's risks of addiction. You're going to get drowsy. All these other things. It's so easy to say, have this script. There are so many other things you can do for insomnia that are so much better for you. It's going to have so much more benefit than take this pill and fall asleep for the next few nights. We 100%. Haven't got to the underlying cause. We're risking side effects by giving medications. We're risking addiction, and it's one example, but it sums up mental health as well.
Yeah, I feel like there's two camps. There's usually like a camp that's like super pro meds, go into it really quickly. Then you've got another camp which is like, don't take meds at all.
Yeah,
and to me, that it doesn't make sense. Like meds can be very helpful for people that can't get out of the house, or they need to get to a point where they're making lifestyle interventions and changes. But for the people that can make those changes, sometimes it might not be as relevant.
I remember years ago when I came back from a deployment overseas, which I was involved in a critical incident with the Army, and I was. To be fair to say, as a part of when you get back, you have to go through medical and psychological screening, and then they pick up, all the bits that have happened to you on the way. And I remember I was quite fragile. I was, and I was not feeling very well at all mentally. And I was with this doctor, and I just wanted her to basically give me an out because I was exhausted.
Yep.
And I was really upset she didn't.
Okay.
What do you mean by
what was that out that you were expecting?
I actually wanted some medication because I was over it all. I was just over it. But she said, I'm not going to give this to you, Steve, because I want you to go through it and I want you to look at other opportunities. So it forced me to go into counselling and stuff like that when at the time I didn't really want to, but I really felt like at the time she had my best interests at heart. And I trusted her.
Yep.
And I was just like, oh no, this is going to be a long journey. But then there are times where, with the doctor, I've agreed that medication has been the right thing.
Yep.
But yeah, it all depends on a whole range of circumstances. But usually your doctor will, if they've got time to talk to you about things, and she did, I'm very grateful.
Yeah, that's it. No, I I think you're spot on. It's unique to each individual circumstance, and yeah, that's one of the most common medications I prescribe. You probably realize that. Yeah, antidepressants, what we call SSRIs, it's one of the most common alongside blood pressure and cholesterol tablets. It says a lot, but that doesn't mean, that every doctor with every inkling of some low moods, mental health symptoms is going to say, oh, well, you've got depression, take this. There's mild, moderate, severe. We look at how much support you've got around you. What's your risk? You know, are you a single guy who's unemployed, who's drinking every evening, a bottle of whiskey, compared to, and it's just an example clearly, but compared to a guy who's still working, still getting up in the mornings, who's drinking a couple more drinks per week, he's not sleeping too well, but he's got a great support around him. We're not worried about his risk of suicidal thoughts, deliberate self-harm. They may both be depressed, maybe, but there's such there's a completely different approach to these, and that's what I try and get across here is it's evidence-based, but it's so individualized. Yeah.
Just earlier on, we talked about the influence the body can have on the mind, can have on the body, which is what you spoke about. What about the influence the body has on the mind? Is there the literacy for men around what you eat, how you sleep, and how you exercise influences the mind? Because we all hear these things being told to us, but I don't think people get it. I don't think people get how much it really influences how you feel. What's your kind of commentary on that perspective?
They are linked both ways. So we talk about, so it's that way. Physical health, I think I wrote this down this morning on my way here. Physical health or mental health starts with physical health and vice versa. Physical health starts with a good, positive mental health. So absolutely they need to be dealt with together. And it takes me back to what we said on my previous podcast interview with you guys about taking it back to basics. And when your mental health is at a stage where you think, I don't know what to do about this, think physical health. Let me start with that because the rest will fall into place, hopefully. So it's sleep, it's diet, it's exercise, it's doing what you enjoy, it's routine, which we've talked about. And bit by bit, it will help the mental health. I truly believe that. I've felt it myself in the last 12 months.
What's your, if you had to pick between sleep, diet, and exercise for your quickest boost? What do you think would be the quickest
for me
boost for you personally?
I know, I could improve my sleep immediately. I get 6 hours sleep a night. And that's lucky. I probably get 5.5 by the time my daughter has woken up, and so I know I can improve my sleep, but I make a conscious choice to sacrifice that so that I can get up at 5 a.m. and run. And life's about sacrifices, so I know I could sleep more, but life's not perfect either. So for me, I know it's sleep. I know that's probably going to help with things like insulin resistance and making me feel that little bit better in the mornings, help with weight loss. But I also know that getting up at 5 a.m. to run probably does more for my mental health, because if I don't get up at 5 a.m. and I'm getting up at 6:30, I feel lazy. I feel like I've missed that opportunity. And so it's individualized. Let me say that. For me, sleep could be my improvement, but actually what's helped more in the last 12 months is my diet, actually. I've drastically changed my diet in the last 12 months because I was in this bad habit of snacking and eating the wrong foods in work because I was looking for a quick fix.
Relief.
Work is flat out, busy. Always felt that I just nip round the chicken shop next door to get a quick snack because I'm too busy. I've got too many work, too many referrals to write, too many bloods to check. I'm running late.
Is that why you brought the KFC when you came?
Don't start that.
just joking.
Yeah. So I was going to bring you guys some protein balls. I passed a few on the way here. I thought, no, I better not. So diet has been mine, but let me tell you the other thing. Exercise. There is so much benefit to exercise that is probably, more beneficial to more systems of your body, mental and physical health, than the sleep and the diet. So I've basically given you the most politically correct answer there, which is sleep, diet, and exercise.
They're all important.
But it's so individualized.
I actually read a study recently There was a big meta study that took in 76 studies conducted by the University of South Australia, I think, and they compared. I think it was about about 150,000 people were in the study from all of the different studies, and they compared medication, moderate to high intensity exercise and psychotherapy, right?
Yeah.
And they measured the outcomes, and exercise came out slightly on top.
Yeah.
And the study was talking about the importance of prescribing physical activity as a mental health strategy, like a very strong one before it's inferred, but it was actually talking about how you can get a boost of 30%.
Well, if we could give exercise in the form of a pill, I think it would be very popular.
Yeah.
It's hard work.
Yeah, I think people.
But it was interesting though, talking about that link. Obviously, if you've got dysfunction in your life, exercise is not going to help you with that. You need to speak to someone. If you've got a medical condition that,
of course,
is causing mental health issues. I mean, there's not one without the other, but it's interesting.
Yeah. So my two observations on that is it's very easy to say exercise, but when you're feeling like the last thing you want to do, what are the practical tips to be able to do that? And again, having the time to discuss that with patients, not say, you've just got to go and exercise. Actually, well, what are we going to do that's helpful? Like? Is that weight-bearing exercise, resistance training, swimming, cycling? What's right for you? How long? And I'd try and go into how long, what intensity. But my second observation on that is there have been times in my life where I thought I was being, let's say, the family man, the responsible man, by not exercising, because my mindset was, I'm too busy. I haven't got time to exercise. I need to work. If I've got an hour to exercise, I've got an hour to go and earn more money. If I've got an hour to exercise, I've got an hour to do something else that I thought was more of a priority. So by me being, thinking I was doing right, I was probably doing so wrong, because hindsight, I want to be there for my family. I want to be a healthier person so that I'm there in 30, 40 years for my family. So the phrase I use is, you've got to be selfish with your health to be selfless as a person.
We've heard that a few times from our guests.
Yeah, really. Yeah.
Sure. It's very good.
So obviously it sounds like you do a lot, to be honest.
I try.
You're doing a lot of stuff. And you're managing a lot. You've got a lot of responsibility. How do you rest? How do you sit in rest, and how do you manage stress? Obviously you've got your exercise and stuff like that, but even then, I think it sounds like you've got a lot going on. You're waking up at 5 a.m. running. Like,
I thought you were going to use the word burnout, and you probably will, or it's probably what was on your mind. I listened to the first podcast, and I know you talked about burnout, Leighton. And very good question.
And you don't even have to have something.
I guess at the moment, I'm not worried about it. And so, I've not thought about it. But that's the worst thing, right? Because you don't see it coming. So I don't think I'm anywhere near burning out. I don't feel as if I need rest. But I spend a lot of time with my family. And that is in the very small amount of time I have, I spend it with my family. And for me, that is all I feel I need. I don't claim to have a big circle of friends. I don't claim to be, going out for drinks and meals with all these big group of friends. But that's my personality. I'm fortunate maybe that I don't particularly need that. I don't strive for that.
Well, you probably see 40 people a day. You don't want to see anyone.
You are spot on. You are spot on.
You just want to be you.
Yeah, in my zone and not speak to anybody. So, so everyone's different. So, but I think, I'll say it again, routine is your friend until it becomes your enemy. Because if you break that routine and you're someone who is hard on yourself, then it can be really detrimental. But for me at the moment, my routine is keeping me going. And I guess I'm just trying to be aware of seeing behaviors in my life where I'm a bit snappy, or we talk about memory, we talk about just little things that you've creeping in. I think I'm looking out for those, and I've got a fantastic family and wife who have got my back, and I'm so fortunate for that.
Well, I've got one more question around 20-year-olds.
Yeah.
All right, you're a GP and you see a lot of men, especially. If you were giving some advice to 20-year-olds that are thinking about seeing a GP, what would that be?
So first, I think for me, we're assuming a 20-year-old.
In their 20s.
Let me
what
start
would be
again.
some GP-centered advice that you wish you knew when you were 20?
So I think first off, get to know the health system and get to know the GP system. You'll be so surprised how many guys are out there, my son included, who doesn't know, probably does now, but doesn't know where his closest GP is, how you book an appointment, how much it costs, how to register there. So I've taken it upon myself. I probably shouldn't have at his age. I had my own son, but I've taken it upon myself to look, I'm registering you at this practice, by the way. You don't even need to tell me if you're going there. Just you're registered. And so if there's any issues, okay, I'm a GP, and you think, you don't want me looking at your hemorrhoids or your foreskin, fair enough. So, so I say, look, any issues, go and there's a GP there for you. So I think that's the first thing I'd say is become familiar with the health system. Sit down and just work out, where's my GP? How do I book? How much it costs? And just start with that.
Perfect.
And get a relationship with the GP.
Yeah, that's good.
If you want that to be me, more pleasure for me.
We've only got a few minutes left, but I've got a quick question that I just want to sneak in.
You just said one.
Yeah, as long as it's not a consult. I don't
it's just a sneak. I feel like, I don't know if this is probably too a bigger question we can discuss afterwards, but sexual health and the link between that and mental health.
Yeah.
Is that an issue that you see with young people that they may not have, might feel either have an STI or something like that, and it influences their mental health because they're not able to manage that correctly?
Absolutely. So the only reason I say that is literally in the last couple of weeks, I've seen a patient, clearly I'm not going to go into detail, but so absolutely, there's a lot of angst and anxiety around, do I have I got these symptoms? Is this normal? I've got this spot or this lump on the tip of my penis. Is this normal? Is it an STI? And we catastrophize. I think that's what a lot of men do.
100%.
And all I would say is, look, for me, I see it so frequently. Just it's easy to say it, but go and get it looked at, because so many times this can be nipped in the bud by us saying, no, that's fine. That's a normal pearly white pimple that we might call it. Or so yes, in the simpler one, we could do a whole podcast on sexual and mental health and the link. But absolutely, it's a big driver for worry in especially young men. I don't think I see it much in women. Maybe I'm biased because I'm a male GP who doesn't see as many women around sexual health. But the guys,
they don't want to talk about it, and they're scared to.
Absolutely, I'm always with pleasure, in a weird way, happy to say, look, let me just have a look, just show me, and I can say yes or no. We need to take this further. And it's a great opportunity to give a bit of advice as well.
Oh, that's really good advice. I appreciate that.
Yeah.
Well, thank you.
No, thank you.
Good for coming in and hearing about what you're doing in men's mental health. And it's very exciting.
Perfect. Cheers, Lloyd. I'll see you around.
Yeah, pleasure.
See you in a sauna. See you in Sam's sauna. See you, mate.